No, it does.
There it
I
is.
think it's recording now. Do you see it?
Got it.
It is.
You got it.
Guys, thanks for having patience with me. Welcome everyone to the Allume Town Hall on October 22nd, 2020. So thank you for being here. I always enjoy having the time just to be together, even if we can't even be in the same room, just to share some virtual space and hopefully get to connect sort of in real time, which is awesome. So lots of things to talk about today. Always our intentions, what our current COVID status is in the state of Connecticut from our governor. I'm gonna, let's see, participants. Let's see if I can, I'm gonna mute everybody, but you can unmute yourself. Okay, yes. Okay, so, all right, so we're going to talk about the governor's most recent updates. We're also going to talk about access to COVID employee testing that having soon, very soon here, probably in the next 2 weeks. We're going to talk about the COVID-19 vaccination and what the latest information is on that. PPE, how to stay safe. We also want to announce some new team members to Allume. We want to talk about can time. So we are rolling out over the next 2 months a new EMR system. So we're going to, between now and the middle of January, we're going to be saying goodbye to Access. I know you're all very sad. And we're going to be saying hello to can time. And we're very excited about it. We want to talk to you about it, what to expect, and ask for your focus and attention on getting signed up for training. Also, we are going to talk about Elsevier. We have several annual required trainings that are due between now and the end of December. As I mentioned the last month, we were expecting a Medicare survey. We felt very sure that they were going to come a month ago, and they still haven't come. So we're still waiting on that. We'll talk about that. And of course, always we want you to be taking care of yourself. So without further ado, we have the power to make an incredible difference to our communities right now in this time of COVID. This has been going on really effectively since the beginning of March. And it's really our responsibility to be leaders in this public health crisis and being leaders in how we conduct ourselves both at work and at home and in the community, and making sure that we're doing everything we possibly can to keep our community and ourselves, and of course, our patients and families safe. So our biggest risk to all of our patients is us, right? Us and others who come in and out of the patient's home. Most of our patients aren't out into the community all that much. If they are, then of course they're also at that risk, but we want to make sure we are not the culprits for why they might accidentally contract COVID-19 or any infection, right? So we want to make sure that we are doing everything we can to keep them safe, and the way to do that is by keeping ourselves super safe and our family members. So our first defense, as always, is PPE, which we have plenty of, and you should use appropriately. Diminish your exposure to COVID-19 by the way you interact in the community and the way you conduct yourself with other humans. And of course, cleaning and disinfecting. Those three things are how we keep ourselves and our community safe. So our current status, metrics as of the 19th. So the positivity rate in the state of Connecticut is 1.7% versus the national average of 5.3%. So think about that for a second. Of all the people in the country, 5.3% are COVID positive or have tested COVID positive at some point. And the positivity rate right now is 1.7% in the state of Connecticut. So we're doing pretty well on a national front, but it's also, our rates, our numbers are climbing. We were below 1%. We were at like 0.4% just a couple weeks ago. And since, probably since schools have started to open up again and people have started to spend more time indoors, I think people might have become a little more complacent. As well, we've seen those numbers go from 0.4% to 1.7%. So that's a pretty big jump. That's almost 4 times in, you know, less than a month. So there were, over the last week, so from the 12th to the 19th, there were 11 hospitalizations and 12 fatalities. Connecticut remains among the lowest in the nation, and Connecticut has passed 2 million tests. So 2 million tests in the state of Connecticut, and we continue to make that a big part of the Connecticut response. We've known this across the world, that, and the CDC has recommended, along with the World Health Organization, that aggressive testing leads to having a much more contained spread. And more people that you have tested, then you feel safe, you can go in the community, and there's less need to always have to be completely isolated. So sports, there's been a lot of talk about sports, and on sort of the national front as well as the local front. It's where there are congregations of people congregating around cars of the event, et cetera, that seem to be causing the biggest areas of concern. Ski resorts are going to be opening. They fall under phase 3. And so they are in compliance, and they can begin operations as the snow starts to fall. So those are areas, you know, being outdoors, I think, is super important. I've been doing a ton of hiking. I hope you're hiking. It's so great to be out hiking. You still need to wear a mask when you're hiking if you're on a, you know, if you're somewhere where there's other people. But ski resorts could also be a good place. But we have to watch. We have to be very careful and mindful about that, because there's still close contact when you're getting onto the lift and so forth, and getting off the lift. So, or when you're in the lodge and you're getting your hot chocolate, that can be a moment of time when you could be in a dangerous situation. Traveling students, that's also, we've seen a lot of students coming and going with the start of the school year. And this is known, as you all know, as being a really sort of high risk in terms of contamination group, because first of all, they don't have always very clear symptoms. And second of all, they're not always practicing the best social distancing. So just be aware of that. You know, your students who are coming back from college might need to quarantine in a separate room. If you have kids at home even, and give yourself a little space and distance from them. So be aware of that. Also, just be aware that right now is a time with the holidays coming up where a lot more of that traffic in and out, students coming and going, as well as family members coming and going. It could be a time when more spread happens, and it's really important that we all sort of hunker down and go back to a higher state of alert. Travel advisory. So updated standard, the travel advisory will apply to 10 states with cases with 10 cases per 100,000 residents and a 5% positivity rate. So this is a change from the past where it used to be per 100,000 or a 10% positivity rate. So it's changed to be 10 cases per 100,000 and a 5% positivity rate. This week's updated advisory adds Arizona and Maryland. And it's important to realize that when you are traveling from one of those places, one of those that are on the map, I'll show you that map, there are 40 states that are affected, that you, when you come back, must complete the CT traveled health form. So it's on the it's on the ct.gov website. And if you don't fill out the form, you could be subject to a $500 fine. You're also directed to self-quarantine for 14 days from the last contact within the identified state, unless you have been tested. So you can be tested unless you have a negative test immediately prior or upon returning state. So they are accepting that. No changes to travel advisory requirements and enforcement for impacted states. So those are some new things about the travel advisory. Can travelers be tested for COVID-19 instead of self-quarantine? Yes, the answer is you can. And you can get in and get that done quickly. What tests are acceptable? Nucleic acid testing is the PCR, as you usually hear them talk about it, is the only acceptable testing option. Either rapid antigen testings or antibody tests for COVID-19 satisfy the testing requirement. But they are starting to become a little more willing on that. So I think that will change. They strongly are encouraging people to just plain not travel. Don't leave the state unless you really need to. Governors of Connecticut, New York, New Jersey announced that travelers from the tri-state are excluded from reporting, self-quarantining, and testing notwithstanding metrics. They're also, government is reaching out to officials in Massachusetts and Rhode Island to discuss whether we can work out a similar approach. So if you travel to New York, you don't have to fill out the form. If you travel to New Jersey, you don't have to fill out the form, but anywhere else you travel right now, you're supposed to fill out that form. You should assume that if you travel to a place on the list of high infection, you will be required to self-quarantine or, and or get a test. And if you have to do that, you should assume you're going to do that with PTO or without pay. So just make sure you're aware of that. So, again, we're asking you not to travel. The states that are affected are in red. And you can see that there are 40 of them. There are a couple that you can kind of somewhat safely travel to, although again, we're saying, please don't travel. These are the places you can travel.
I can hear you talking, but I don't see the images you're talking about.
Oh, okay. Nobody else can see my images either? The screen share?
I can see them, Coco.
Okay. Not sure why you're not seeing them on your phone or on your computer. So I'm not sure. So I could send out the deck, but it's basically, most of the country, pretty much the whole country, with the exception of the Pacific Northwest, Washington, Oregon, California, and New England. But it excludes Rhode Island. So that's where that is. This is a new image that the state is putting out. This is the average daily rate of COVID-19 cases. And it shows you the places where there's high density or high population of COVID-19 cases. You'll see here, it shows you what the legend is here. So if it's in gray, it's less than 5 cases per 100,000. If it's in the yellow, it's 5 to 9 cases per 100,000. If it's in orange, this orange color, it's 10 to 14 cases. And if it's in the red color, you'll see that it's 15 or more per 100,000. So you can kind of get a sense from here what towns are kind of hot. Most of our area that we serve in is is either in yellow or in gray. There are a couple of orange spots. So just be aware of that. You can check that out on the portalct.gov website. Here's some more information about our current status as of the 20th. You can see the total COVID cases, deaths, patients currently hospitalized. So you can see there have been 64,000 cases, 4,500 deaths, and there are 213 people hospitalized. There have been, 2 million COVID PCR tests reported. And just in one day, you can see an increase of almost 16,000 tests. So the number of increased tests is, I think, a very positive thing. It means we're really, really making sure people are safe. You can see where in this slide shows you the density where most of the COVID-19 cases have been confirmed or believed to be. So you can see Fairfield County is high, Hartford County is high, New Haven County are the highest. Those are where the largest amounts are, but certainly everybody is susceptible, right? And all of our communities are at risk. So access to employee COVID-19 testing. So the Department of Public Health, as I mentioned at the beginning, is in the process of distributing a new type of COVID-19 rapid test. And it's going to be it'll include Allume and other home health providers. We will hopefully receive them sometime in the next week or two. It's called the Abbott Britax Now Rapid Test. And it's a fully contained test that we can administer. We don't need to send it to a lab. We don't need a special machine. It's these little kits that they give you, almost like a pregnancy test where it's all included. The whole test is right in the box. And so we will be using them for employee testing only. And it's, so, you know, if somebody is exposed to someone who has COVID-19 or is believed to possibly have been exposed, we now have a way to distribute that test right away. It's a nose swab. It is not the one that goes way up into your nose. It's one where you do the circle around in circles like 5 to 10 times, whatever the instructions are. And it's even one that you can self-administer with someone watching over you. So we will have access to those. And, you know, every time we do one, we obviously have to fill out paperwork and distribute it to the state. And we're learning more details about it, but those are the basics. So I was just on a call an hour ago with the Department of Public Health, and they were giving us more information about it, but it can be administered, self-administered, and it can be administered by anybody who's here in the office. And so it gives us the ability to test our employees. It's not for use with patients, it's only for use with employees. All right, so the vaccination program. So this is something that you might have been hearing a little bit on the news. I can't remember if I shared anything about this last month. So, but basically there are 2 vaccines, COVID-19 vaccines, currently in stage 4 clinical trials. So they are mass testing them right now, and they have been now for a couple months. At the same time, right now, they are mass producing both of the 2 vaccines and distributing those tests throughout the country and storing them in really cold trailers, basically. And they're all over the country, and they have both vaccines. And so it's sort of Super Bowl style that one of the 2 vaccines will be the winner, kind of makes it through all the things and is selected by the government as the one that will be used. And the moment they make that selection, then they will start the distribution. And they'll say, okay, let's go. We're starting to do it. Right now, across the country, there is there's a team from all the way from the federal government right down to town level, where they are putting together a big program to distribute. Marie and I have been involved in that process of learning about the distribution and participating in the distribution, being part of the plan and the rollout. So what we know is that both of the 2 vaccines that are up for grabs are ones that will require 2 doses, and they are about 30 days, about a month between doses. So you'll get your first injection, and then a month later you have to come back and get a second one. And there will be a period of time, I don't yet know what that period of time, before it's really effective. So so it will be a couple of months, right? Once we have it distributed to a person, it'll be a couple months before that person can feel like they are, you know, the vaccination is working. They said that they expect the vaccination to be 50 to 70% effective. So it's not like a polio vaccine, right? This is a virus, so it's not like polio. It's a virus that mutates, and similar to the flu, it will continue to mutate. So it won't be like you'll get your 2 doses and you'll 100% not get it. It means that you'll get your 2 doses and you'll be 50 to 70% likely of not getting it, or that you will be somewhat more resistant to it. But those are some of the expectations to set. It's not like a perfect silver bullet, but it is great and it's improvement for sure. So the way they're going to distribute it is they're going to have phase 1 frontline workers, phase 2 vulnerable populations, and they have a whole way of defining what that is. I know also they also mentioned is right away in phase 1, they're going to be directly distributing to assisted living and skilled nursing facilities. So they'll get them immediately out to those places as well in phase 1. Phase 1 is frontline workers, which includes, of course, Healthcare, anyone in healthcare would be part of the frontline workers, which of course includes us. And it also includes people like EMT, firemen, teachers. These are all considered the frontline workers. Then would be their vulnerable populations, and then after that, the general public. So it'll take a couple of months, right, for it to be fully distributed. And again, a couple of months for everybody to receive the vaccination. Those, and probably not everyone will decide to get it, but for everyone who decides to, there will be some time to get it, and then some time for it to become 50 to 70% effective. Allume will be participating in the phase 1 distribution to frontline workers. So we'll be providing vaccines through a drive-through vaccination clinic that's being already planned out by the Department of Public Health and Litchfield County. So that's just something for you to know about and be aware that's happening in the background. This morning, on the DPH call, they said that, what they said, and again, they don't have a lot more information, I don't think, than we do, but the timing of all that distribution and so forth, sometime in 2021, sometime in first or second quarter. So it probably won't be January, maybe it'll be February, March, April, somewhere in that time is when it'll start to roll out to frontline workers and assisted livings and SNFs, and then from there. So that's a little bit of information. A lot of it's speculation and conjecture, but do with it as you may. With the COVID levels rising in our community and the cold weather coming in, we should start to expect added safety measures, I would say, coming in. So we should prepare for that, right? We will continue to operate as a company mostly in a virtual fashion. We're more in the office now than we were. I think we're operating safely, but we may cut back even further at some point. Limited staff in the office, so we have our ambassadors here in the office. Nanette and Jennifer are always here. I like to have a human resources person here as well, so Christine's here often. We've had administrator or SCS or both here, so the goal would be to have at least one of those in the office at all times. And then we're continuing to do training and orientation. So Jen Williams, our educator, has been doing orientation 2 days a week, and she's right here in the office. Also, we should expect possible closures or added restrictions in the coming weeks and months. Schools probably going more in and out rather than going out for a long period of time is what I'm hearing, is kind of what the goal is, or to break it up, right? To have, if you're in the building 5 days a week now, maybe you might be in the building 2 days a week or 1 day a week or whatever. So these are just things to be aware. And in the meantime, the most important thing we can all do is be vigilant. Now is not the time for complacency. Now is the time to double down, just as the peak is starting to come back again. Again, you know what the symptoms are: cough, shortness of breath, fever, chills, shaking with chills, muscle pain, headache, sore throat, new loss of taste or smells. Somebody needs to make up a song like this, like two all beef patties, special sauce, lemon cheese, right? Somebody needs to come up with a song for this to make it at least a little bit more fun. You know about the questions. And I would guess you're probably not all asking the questions when you go to the homes every day. I ask you to please do that. We do it here in the office, right? Every single day in the office, I sit in my car and I fill out a form and I answer all the questions, and I come to the door and Nanette unlocks the door and lets me in and takes my temperature. So please be vigilant with this too. I know it seems redundant and kind of goofy, but what it does is when you go into the home, and especially if it's a home you're there all the time, it just keeps everybody in check, that we're being vigilant, we're being responsible. Let's just keep doing this because it's what's needed. So so I ask you to please do that. It's important for yourself, it's important for your patient, and it's important for the community. Personal protective equipment we have in the office, plenty, not as in go crazy and be frivolous and irresponsible, but we have enough, and so you can have 1 month's supply to yourself at a time. So when you're seeing patients, reminder at all times, the surgical mask is required at all times. Gloves, eye shield, really important, the eye shield. During aerosol producing procedures, also wear your isolation gown and the disposable apron if you're with a COVID suspected or confirmed patient. Now in this fall, it's possible we could see some patients, especially on the skilled medical intermittent side, we might have more potential patients that are COVID positive. So if that happens, really make sure you have, it says surgical mask, it should say N95 mask here, gloves, eye shield, isolation gown, and then, and of course, wearing the disposable apron on top of the isolation gown when doing aerosol producing procedures. So just be aware of that. We have enough supplies for you to collect your 1 month supply. Make sure you have your 1 month supply with you. Work with your care team to make sure you have what you need. So coordinate with your case manager to bring stuff out to you, come into the office and get it yourself, talk to your ambassador, see who else is going to the office. Maybe they can pick up your PPE for you. So just make sure at all times, mask, gloves, eye protection gown, you're protecting yourself and the team. Reminders, travel ban, virtual meetings, refrain from crowds, don't meet indoors, limit number of people you interact with, 6 foot social distancing, clean and disinfect every 4 hours. You know what the CDC guidelines are for your household. Make sure you let the administrator know. Marie needs to know of any exposure. So if you are out in the field and you find something out that has somebody in the house where you work or a patient or something, please let Marie know. If you are an ambassador, so if you're Nanette or you're Jennifer and you hear anything, or you're Taylor, right, or you're Christine, or you're a case manager, you hear anything that smells like it could be a COVID related exposure, you need to let Marie know. Marie has a very specific process that she follows. She puts it into a spreadsheet. We make sure we do contact tracing. We make sure everybody stays safe. It has to go to Marie. Just has to. Don't punt, don't try to be creative, just send it straight to Marie. And don't come to work when you're not feeling well. Okay, so you know about the staff screening form. That happens every day. You get a text message. Please make sure you answer those questions every day. That is something that Marie looks at, and we will need those. It's part of our responsibilities, part of our COVID infection control policy. We will need those to prove that everybody has been safe. And so please make sure you do that. I keep a thermometer or whatever that you do on your head. I keep it right on my counter so every morning I get my coffee and the first thing I do is I take my temperature and I text over and, send the form over to Marie so that she can know that when I come into the office, I am not bringing COVID with me. At least we hope. So wash your hands every 15 minutes, clean and disinfect at least every 4 hours. Again, we've communicated to patients that you will be wearing masks, gloves, gowns, eye protection. You will be doing your daily temp screening, that you are participating in any risk assessment with Marie should you be exposed, and that we've discontinued OT. So those are some things you should know. We've also asked patients to know that they're going to participate in the 4 screening questions. You should be asking them every day. We've told them that we would like you to post the 4 screening questions near the patient's bed. We've asked families to really limit their, practice social distancing and stay out of crowds. Don't be outside or don't be inside. Agree to 6 foot social distancing. No visitors indoors. Any visitors should be outside. We ask that they wear a mask in your presence as well as the presence of a patient. So those are some things we've been communicating, and we should make sure if you have any instances where it's not happening, please let us know. Welcome new team members. So we have some new people, right? So I'm excited to announce that we have a new clinical supervisor of clinical services, starting on Monday, the 26th. Libby Joy is her name, Elizabeth Joy, but she goes by Libby. And she is Amy's replacement. Amy left a couple weeks ago, and we were very sad to see her go, but she's going on to do fun, bright things, and I'm sure do great things where she's headed. And we will miss her very much. She's contributed tremendously to our organization, and we're sad that she's gone, but she leaves us in good shape with our continuous care practice. So Libby will be starting on Monday, the 26th, and she will work closely with Kyle and Marie and continue to provide remarkable care to all of you and to our patients. We also have 2 new case managers. So Megan started 3 weeks ago, I've lost track. And Nicole is starting also on Monday. So you might be seeing some new case managers out in the field. Please welcome them, make them feel at home. I know Megan spent almost a full week out in the field working with, shadowing shift nursing so she could get a sense for that. Nicole is going to be out doing some, and Libby will be doing some shadowing as well. So please welcome them when they come out into the field. We also have Carol Cole, welcome, who's our new home health aide. And we have several new shift nurses. So these are people that have started in September and October so far. So Tashima and Nakia and Felicia and Catherine, Marianelli, Toya, Trisha, Jennifer, Tanya, Alicia, and Janice, welcome. Can time, okay, very important, all right, this is really important. So there's a lot right here that I want to tell you about, and please listen because it's a lot to take in, and cooperation and collaboration on this rollout will make our lives so much better and easier. So Can Time's our new EMR system. It's going to replace Access. This system will be ready to go live on November 1st, which is like really soon, right? It's less than 2 weeks away. And we will be fully transitioned from Access to Can Time by January 15th. So we can't just turn it on and on it. We have to wait until the next patient research. So that's how that works. So starting on November 9th, rollout to the patients will be driven by whenever the patient is scheduled to recertify. And so we will move patients and their care teams to Can Time. So there's a schedule that we have that we're going to distribute. We'll probably hear about that from your case you'll hear about that from Christine or your ambassadors. You'll find out about the timing through them. And as that happens, you will need to be trained. So we will have case manager Can Time training taking place next week and the week after. And then shift nurse training will take place along with competency evals. They will take place in between November 1st and right up into January. And so we've scheduled about 20 training time slots. They are 2-hour training sessions to take place in the office. You'll be paid $40 for successfully completing the training. You will select a training date time that is within 2 weeks of your recert date of your patient. So we don't want you to come like next week and do it if your patient isn't recertifying until the end of December, because you'll forget everything, right? So we want you to get the training kind of as close as possible to your start date when your patient will be moving over to Can Time as possible. But it's really important that you get there. So it's when you sign up, you got to commit, you got to like make it like important that you come so that you're sure to be able to start when your patient starts. We'll also have home health aid training. There aren't as many of you, so we'll coordinate those with you one-on-one to determine the timing of your training, and your training will probably take about an hour, and you'll be paid your training rate. On Can Time, we expect to be fully electronic. So in Access, we've had MARS and TARS and some of the logs that have been on paper, and the plan of care process of creating the plan of care with the case managers has been in Word, and then you copy and paste it into Access. Everything will move entirely into Can Time. At least that's the expectation right now. So it'll be an interesting time because while your patients if you have a patients that aren't transitioning, for example, until December or January, then you'll continue to need case managers. You'll need to produce the MARS and TARS in the current format, right, on Excel. But as soon as they've transitioned, then you won't need to produce those Excel administered MARS and TARS anymore, because it will all be in the system. So if you're a shift nurse, you will administer the medication, and then you'll, instead of writing it down, you're going to go into the system and mark that you've completed it. And the other nice thing about that is that it also has a little bit of QA functionality built in. So if you don't give the med and it's supposed to be given, we'll get an alert, and it will just help us make sure we stay on top of it. So to do all of this, and it is a huge undertaking because everybody's got to learn a new system. Every single person in the company will touch this system, absolutely everyone. And everyone will be learning how to do their thing, whether you're a scheduler or you're a biller or you're running payroll or you're out you're providing shift services, or you're doing start of cares. Whatever it is, your job is going to be new, because you're going to be doing it on a new platform. So everybody's going to be learning, and that oftentimes brings out frustration and anxiety. So we all have to really sort of take a deep breath and remind ourselves, okay, this is going to be new. We'll try to show up to work early, get there, be ready, make sure you really come to your trainings, digest it, learn it, be, as I like to say, pack your own bags, carry your own bags. Be the person who's ready and willing, because your whole team is going to be doing things that are new. So try your best to be responsible as much as you can for yourself. Be a good, responsible teammate. Sign up for training early and get the time that you want. There will be, a maximum number of spots that you can sign up for, because we have to social distance and all the rest. We have to keep it safe. So sign up early and then commit to it. Show up, be on the training. The other thing is, and I want you to just put this in your mind, okay? And I know everybody loves to get paid on time. You will need to be super responsible for yourself. There's going to be 3 systems: Access Private Duty, Access Agency Core, and Can Time. All 3 systems will have schedules in them. All 3 systems will have to produce billing, and all 3 systems will have to produce payroll. We didn't triple the size of our finance department to do this for the next 3 months. It's the same number of people, which is basically 3, right? 2.5 actually. And so we need you to be really, really responsible for yourself and getting your paperwork done, getting things done so that things are wrapped up with nicely. And if you're for payroll to be run through these 3 systems, it's important that you get your training, your materials done on time. If on a Monday at noon, you did not get your documentation done the week before, you will not be paid that Friday. There will be no exceptions. If you put it in at 12:01, I'm going to say to Jen, no, I'm not going to make you go and chase that person down and figure it out and whatever. You will not be paid. So it has to be done by 12 o'clock on Monday every week for the week prior, or you have to wait an extra week to get paid. Case managers, we're working together with Marie, Kyle, and Libby to get Plan of Cares, Mars and TARS, and Can Time. This is going to be new, right? They're going to have to learn how to do that. So we ask you to be sensitive and flexible with this. If you're in the field and you see that things don't look quite right, or you are used to seeing certain meds and you're not there, please let us know. Your extra eyes will help us. You know your patients inside out. So your extra help will help all of us. If something doesn't look right, call the case manager or call the supervisor, and so that you can find out we may have made a mistake in entering. So please help us with that. And so those are the big things. Massive amount of cooperation. It's going to be much better for everyone, though. I have to tell you, the whole system is much easier to use once we've gotten used to it, and you'll be able to. The whole company will be singing, you know, happiness in the rain, right? Like we're thank you for this new system, because it really will help us spend less time doing silly busy work trying to make sure everything's working right, and focus more time on value added things like patient care and employee satisfaction. All right, so Elsevier, on top of it all, we also have some Elsevier annual required training, and my slides appear to be out of order. So let's see here. Let's talk about the Medicare survey first. So the Medicare survey we're expecting, please remember to wear your badge, make sure you have PPE, make sure you have supply and are practicing infection control back technique. Make sure there's a plan of care. Please today look and see if you're in the patient home. Is there a plan of care printed in the home? Make sure that all your documentation is excellent. Your MARS and TARS documentation is excellent. Your marking and that you are providing patient education and that you're documenting. Make sure the go bag is all put together and has everything it needs, right? We've had situations really, truly where a go bag is missing something, and that's a problem. Or the go bag is forgotten on a trip to a doctor or wherever out into the community, and that actually is a big problem. So make sure your go bags are all ready to go. And also take a look at your individualized emergency preparedness plans. Make sure they've been looked at and updated recently. Make sure you've completed your CPR, right? And your in-services and your performance appraisals. The performance appraisals, there's still a few that are out there that are past due. Please make sure to get those over the finish line. Let's see. These are things you've heard before: badge, CPR, performance appraisals, in-services, PPE, plan of care. So again, the Medicare survey is all about quality, and ultimately it's about remarkable care. So that's the reason why it's there. So we're all doing a great job. Everyone is out there delivering unbelievable service to our patients and our community. So we're very confident that it will go well. We just ask you to just put that extra focus, as you always would, on delivering remarkable care and really being excellent in your practice. So where is my slides for, I don't know, they're missing. So I also had some stuff I wanted to tell you about for the Elsevier. So how it's going to work for October, November, and December required training. I've asked Julio to go ahead and distribute all 3 months worth of training, and it's all due on the 31st of December. Don't wait until then, because it will take you some time to get it all done. It includes a whole variety of things that we have to have done every year, and I'm not going to remember them all off the top of my head, but it includes things like code of conduct, our compliance program, dialing 911, safety procedures. It includes diversity and cultural practices. It includes bloodborne pathogens. It includes dementia, all different kinds of things. They're all packaged and ready to go. They're waiting for you. Please make sure you do that. Again, they're not due until December 31st, but get them done now, please. As soon as you get them done, you'll get paid for 3 months of training. All right, last thing on the list, take care of you, right? Go for some walks right now. Take a nice hike. The weather is beautiful. The trees are extraordinary. Take some time. I encourage you also to consider starting a bullet journal. If you don't know what that is, do a search on Google and find out what a bullet journal is, or go on to Pinterest and get some ideas. It's really fun, and it's also a nice way to help center your mind and yourself. I created one for myself and for Ella Pearl, and it's just really fun. It's a nice way for her and I to connect with each other. We list all kinds of things that we're working on. So we'll have a page that's all on feelings. For example, how am I feeling right now? And you color a different leaf, right? So she colors leaf and I color a leaf. Or but it could also be like making sure that you're drinking enough water. So maybe every day you have little, how many little cups of water you drink. So you might fill in your little cups of water. It's fun and it's helpful in getting you to develop habits and practices that support your best self. All right, that's all I got. Does anybody have any questions, comments, anything? I see question about de-seed OT. Patient is receiving OT in the home. Also, what is the process for family members coming from other states? Good question. Okay, so question about de-seed OT. Patient is receiving OT in the home. I'm not sure what the question is. So if you could clarify that, Karen, ask Marie, because I'm not sure what that situation is. And that's a great question. So if you happen to know that if you have a patient and in the home there are family members coming from other states, please let us know. If you have family members coming from other states, please let us know. And I would say you probably need to have them, if they're coming from one of those other states, the rule around that is they need to quarantine, which means if they're in your house and they're staying in their own room, they can do that. But when they come out in public spaces, like in your living room or at your kitchen, they need to put on a mask. I know you don't probably want to hear me say that, but that's what you're supposed to do. My family, as a matter of fact, we just had our Thanksgiving last weekend. We did it outside under a tent, and we had we served everything outdoors, and actually we're pretty careful about masks and everything as well, even though we were outside. We set at separate tables for each individual family. So my little Sellman family, we sat at one table, and the Irvin sat at another, and the Ricketts sat at another. And so we all got together, not exactly in the way we used to, but these are things we need to do, right? This is how we have to be remarkable right now. So if you have any other questions about that, certainly let me know. Any other comments or questions? All right. Thank you, folks. It's always a pleasure to be with you. Enjoy your lives and families, and go make the world a better place. It's good to be with you. Bye.
Thank you, Coco.